is we get the blood in, and it's couriered to the laboratory overnight.
Okay.
Because we want to get the blood while it's still fresh, while all the blood cells themselves are still alive, all the various proteins that are in the blood that can be involved in a reaction to a food or substance are still viable. And the first thing we do is we dilute this blood into a buffer, and then we divide it into very precise subsamples so that a small quantity of the blood is exposed to each one of the 100 or 200 or 250 different items. Essentially what we're trying to do is create the same kind of conditions in the laboratory that do exist when a person is exposed to this array of foods or food additives or chemicals and so forth. So the blood, while it's still alive and in its whole form, it's not separated out at all, it is exposed to each one of these individual items and allowed to interact with the food or the substance at body temperature for a period of time. The next step is that some of the samples go through the analyzer. Now these are samples that we use as a control to create a baseline, which is a picture of your blood without exposure to the allergen, and get an idea of the condition of your white blood cells on a baseline basis, if that makes sense.
Okay.
And then we put each individual test sample through the same analyzer, and that helps us to determine whether or not the immune system cells have reacted to the food or the chemical within the test tube under these conditions. It gives us a very clear indication as to whether or not you will react to this food or this substance when you actually are exposed to it or when you eat it.
Okay, just suppose, let's take pork for example. That is, so I understand this correctly, it's put into the blood, and then the white blood cells react, they bulge. What happens? I mean, how do you know? What happens?
Well, there's a couple of different things that can happen. Typically, the white blood cells can actually be seen to be releasing chemical mediators which are intended to neutralize or destroy the food, and they're mistaking the food for being a bacteria or a virus that is potentially damaging. You could actually see, if you were to look under a microscope, these chemicals being released from the cell. And it's important to note that this process is what is the major source of the inflammatory process that we're seeing occurring across the board with so many disease states that are common in modern day industrial society.
Okay, aside from foods and vegetables, what else are you looking at?
Well, we look at all categories of foods and spices and the things that people are exposed to, including some of the common items that are added to food for preservation or flavor enhancement or colorings.
What about coffee, tea, and things like that, caffeine?
Sure. Yeah, a person can have an adverse reaction or a sensitivity to coffee or to tea or various herbs or condiments, to dairy products, to meats, to eggs, to fish, poultry, grains. It can be anything, really.
In your book, Your Hidden Food Allergies Are Making You Fat, you make a statement. You say that the ALCAT is a medical breakthrough for the 21st century. Elaborate on that.
Well, I believe it is a medical breakthrough. I like to sometimes say it's a 2,500-year-old new paradigm, which sounds like a paradox, but it was about 2,500 years ago that Hippocrates stated, "Let thy food be thy medicine, and thy medicine be thy food."
Okay.
So it's a cliche, of course, but we very much are what we eat. Now the question is, nowadays, food has changed so much. Particularly in the last 50, 60 years with the onset, for lack of a better term, of commercialized agriculture. Okay. Foods are grown not in the way that they used to be, and it's not really the same food. We now have manipulation of foods with genetic techniques. We now have transportation of foods from one part of the world to the other, and therefore people are eating foods that they're not real, that their ancestors did not eat. They may not have evolved.
So you see reactions in the laboratory to these foods?
We see the reactions in the laboratories to the foods that really reflects the reactions that people in society are having to these foods. That's what this is all about.
Dr. Pescatore, he says, "Let thy food be thy medicine be thy food." Do you use food as a medicine in your practice?
Absolutely.
Is that an overstatement?
No, that is the basis of everything I do. When a patient walks into my office, first thing I do is establish or reestablish their diet. That is the bottom rung of the pyramid of health.
Okay.
If you cannot get your diet right, there's no amount, it's like sticking your fingers in a dike until something else will fall apart. You've got to get the base of the pyramid done, which is getting your diet right.
I want to see if you agree with this. In his book, and I'm quoting your book, Roger, that he says that he compares foods to drugs. And just like drugs have side effects, foods have side effects. You agree with that? Food is a drug.
Well,
or can act like a drug.
Food certainly can act like drugs, and food certainly can have side effects. But I think the real important take-home message is that what might have a side effect for me may not be the same side effect for you. And so you can't expect it. That's why an ALCAT test is so important, because each person's is individualized, and it'll be different for you and for me. So food is absolutely a medicine. I mean, when you think about what's in there, I mean, you've got antioxidants, you've got vitamins, you've got minerals. I mean, this is where we're supposed to get our nutrition from. We don't anymore. We don't get our nutrition from there. That's why we have a nutritional supplement industry that's huge in this country, because we've got to get it from other sources, because it's impossible to get it from the foods that we eat because of the way the food's manufactured.
So Roger, how accurate over at your lab do you think you are at mimicking the result of a food compared to in the human body?
Well, fortunately, there have been some very important and rigorous studies done, so that I don't have to really express what I think. It's been documented. There have been some studies that have compared the results of ALCAT tests with what is considered the gold standard in this form of testing, and that is a double-blind oral challenge, whereby the person actually eats the food under double-blind conditions, meaning that neither the person eating the food or the researcher, who may be a physician or a dietitian instructing them to eat the food, know whether the ALCAT test predicted it as being an offending food or safe food. And the correlations with foods and eating the foods and the results of the test are 84%. And in a study also very carefully done, comparing oral challenges of food additives with ALCAT test results, the correlation was actually 96%. So the accuracy level is extremely high.
Roger, these tests, I mean, this company's nationwide?
Yes, this test is available not only throughout the United States, but through most places in the world.
Now, how does somebody find a doctor like Dr. Pescatore that sees this of value? Because not all doctors, I guess, even know about this or are using it.
Not all doctors are using it, and certainly not all doctors know about it yet. The way to get a referral is to contact the laboratory, and we have a database of referring physicians.
Roger, the subtitle of your book has to do with longevity. Why did you choose that subtitle? I mean, what is the connection with food sensitivities?
There's a strong connection, Randy. The proper diet, a diet which is compatible with a person's individual biochemistry, I think is the strongest, most powerful anti-aging medicine that exists. And the reason is this. The very foundation theory of anti-aging is that free radicals, which are produced in the body from a couple of different sources, the major source being the activated immune system, is the major cause of aging. Essentially, free radicals, which are produced in order to, it's not the only source of production, but the immune system is the major source of production of free radicals, which can denature DNA, destroy DNA.
This is free radicals to fight off foreign invaders?
Free radicals are produced by the immune system, yes, in order to defend the body against invading microorganisms.
So you're saying by eliminating the foods that...
By eliminating the foods that the body mistakenly attacks as though they were pathogenic microorganisms like a pathogenic virus or the bacteria, it means that the immune system calms down and we don't have that inflammatory process occurring on a chronic basis. Now that inflammatory process is damaging to protein structures, which means hormones and chemical messengers. It's damaging to cell membranes so that the cells don't function properly.
Well, let me ask Dr. Pescatore for a second. Do you think these hidden food allergies can put stress on the immune system?
Absolutely. I mean, that's what we've been talking about this whole time, is that an intolerance in your body will put stress on the immune system, and the immune system is overreacting to all of this. So the whole purpose of anti-aging, the whole purpose of trying to live better, is to decrease inflammation in our body.
Okay.
And that's I think the ALCAT test is the easiest and first place we should all start.
Roger, I want to thank you for coming on the show. Very interesting.
My pleasure. Thank you.
Okay, Dr. Pescatore, thanks for coming on the program. Very interesting. Somebody watching this, what do you say to them? They've self-diagnosed themselves, saying, I have a food sensitivity, hidden food allergy.
Go find a doctor that can give you this test. Call the company, have them refer you to somebody that can do it, and get the ALCAT test done. It's the first way to start.
Great. Thanks for coming on the show.
Thank you.
You've been watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. If you would like to see this program again online, visit our website at wellnesshour.com. For now, I wish you good health.